Hi, this is Bob Finberg, owner and principal of Lancaster Insurance Services. We are independent agents located on the corner of 10th Street West and Avenue L10. Our number is 726-1337. This morning I want to bring up a subject called medical insurance. There's a lot of talk about medical insurance lately. Beginning in the 7th of October through the middle of November, there is open enrollment in Medicare programs, anyone who's Medicare eligible. And there are basically two types of people that are eligible for Medicare. Once you've reached age 65 and you have been contributing into payroll taxes, you become eligible for Medicare Part A automatically at 65. Then if you don't have other insurance, you enroll in Part B. Part A is hospital and Part B is doctor. And the other group of people that are eligible for Medicare are those who are totally disabled and entitled to Social Security, and they can apply to be on Medicare also. I don't really want to go too much into the subsidy part of it, but the government does give what they call extra help, in their own words, to those who need the money, who need the financial help in paying for their Part B and any other expenses that go along with Medicare. There's a lot of talk with the Obamacare, or the Healthcare Affordability Act is what it really is, that became law 2.5 years ago. And it's being implemented in sections. Beginning in a couple of weeks, like October 7th, those who are in Medicare or who are aging into Medicare, who already have Medicare, we're coming into the period known as open enrollment that lasts for 6 weeks. In that 6-week period of time, here's what I'd like you to know. I have the Medicare answers. Give me a call. Let me know. I specialize in it. I certify every year to be able to represent several different insurance companies on Medicare and specifically Medicare Advantage. Medigap policies or Medicare supplement policies have been around as long as Medicare has. So somebody can have original Medicare, whether they are an under 65 disabled or whether they are 65 and eligible. They can get a Medicare supplement. So they have original Medicare, they pay for their Part B. Part A is always paid for once they're eligible. And the Medicare supplement basically picks up their copays and deductibles. It has a very set premium on it, and the premiums are pre-adjusted and pre-banded. As an example, from age 65 to age 69, the rate's the same. It is not gender specific, and there are no discounts for husbands and wives on the same policy. That's the way Medicare works. I find that Medicare has generated so many questions, and it's a pleasure for me to study that, make the information available to the public. I would really like and encourage everyone to give me a call. There's absolutely no obligation. I will talk to you about Medicare Advantage. So Medicare supplements pick up copays and deductibles. Then a few years ago, Part C came along, and that's called Medicare Advantage. And it comes in mainly 3 different kinds. One is the traditional HMO. The other one is a PPO, which is called a Preferred Provider Organization. And then there's another one called Private Fee-for-Service. And there's a few other minor ones, but those are the ones that are the most important. And then the next most important one is called the Prescription Drug Program, which is PDP, and that is also part of Medicare Advantage. So there are Medicare Advantage plans that are PPOs that include your Part D. And in Los Angeles County, from 2011 through 2012, there hasn't even been a premium. You just pay a copay to go see the doctor, and you see a copay if you have to go to the hospital. You pay a copay if you become hospitalized or you receive tests. It's all very reasonable. I have personal experience with it. I'm on it myself. My wife's on it, and I probably have 24 clients here who are on it. And every year, that number almost doubles. So that has a lot to do with people turning 65. And so there are Medicare questions. I have Medicare answers, and I would really like to encourage everyone, especially here in the Antelope Valley, businessmen. It doesn't matter, anyone at all. Give me a call. Let me know. You've got Medicare questions. I've got Medicare answers.